Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 4, 2025. This video is on a New England Journal of Medicine article published on October 29, 2025, titled Deferring Arterial Catheterization in Critically Ill Patients with Shock. An accompanying editorial is titled A Less Invasive Approach to Intensive Care. Arterial catheters are widely used in shock for continuous invasive blood pressure monitoring. However, evidence from randomized trial has been lacking. This was a multi-center, open-label, non-inferiority randomized control trial across 9 French ICUs. They include adults with acute circulatory failure within 24 hours of admission. They randomized to early arterial catheterization versus automated brachial cuff monitoring. Sample size 1,006 individuals, 504 received non-invasive and 502 had invasive arterial catheterization. Mean age 66 to 67 years, 65 to 70% were male, 50 to 57% had septic shock. The primary outcome was 28-day all-cause mortality, follow-up up to 90 days, statistical adjusted risk difference with 95% confidence interval. They used a Farrington-Manning test. What did they find? 28-day mortality was 34.3 in the non-invasive group versus 36.9% in the invasive group. Adjusted risk difference minus 3.2 percentage points. P-value 0.006 for non-inferiority. Arterial catheter-related hematoma and hemorrhage 1% in the non-invasive group versus 8.2% in the invasive group. Catheter-related bloodstream infections lower in the non-invasive group 0.6 versus 2.7 in the catheter group it was 0.6 versus 2.7 per 1,000 ICU days. Limitations: unblinded design, incomplete patient-reported pain data, higher arterial puncture attempts in the non-invasive arm, limited trauma and morbid obesity populations. So there were not enough populations with morbid obesity or with trauma. Key takeaways: non-invasive blood pressure monitoring was non-inferior to early arterial catheterization for mortality and shock. Avoiding routine arterial lines reduces procedural harm without compromising survival. What does the editorial say? Context and theme: modern ICU can be less invasive and more patient-centered. This EverDAX study supports deferring arterial lines in shock when safe. Key data: similar 28-day mortality, 34.3% versus 36.9%. Fewer catheter complications, slightly more cuff discomfort in the non-invasive group. Practice shift: routine arterial lines no longer should be the default approach. Individualized decisions: bottom line, prioritize comfort and avoid unnecessary invasiveness without sacrificing outcomes. Clinical pearls: automated non-invasive monitoring is safe in most shock patients. Arterial catheter-related complications and infections are not trivial. Hemodynamic management should not reflexively default to invasive lines. Non-invasive monitoring may suffice even in vasopressor-treated patients. Eponyms: the Farrington-Manning test is a non-inferiority analysis in proportions. The SOFA score is the sequential organ failure assessment score. And the SAPS-2 score is the simplified acute physiology score 2. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.